I'm a Canadian dermatologist, Montreal-based. I practice office-based. I am also the CEO of a clinical or contract research organization specialized in dermatology. In this specific study, I've acted as an investigator, in fact, the lead investigator in a multi-center study that was sponsored by Janssen. I've had a long-standing interest in psoriasis. I started to use biologics in psoriasis almost 25 years ago now, with some biologics that are not even on the market nowadays, including some of the most often prescribed treatments for psoriasis today. Very good. So this was a typical phase 2b dose-ranging study where patients with moderate to severe psoriasis, defined as PASI 12 plus, BSA or body surface area 10% plus, and physician global assessment moderate or severe. So these patients were randomized to increasing or ascending doses of JNJ-113 or placebo. So the study tested 5 different doses of JNJ-113 versus placebo. The patient population in terms of inclusion-exclusion was fairly similar to other phase 2b and 3 studies conducted with systemic agents in psoriasis. So as everybody knows, you cannot really compare 2 drugs unless you do a head-to-head comparative trial. However, because inclusion-exclusions are fairly similar, I personally believe that it's not incorrect to do some kind of an indirect comparison. So the primary endpoint of the study was PASI 75 at week 16. So patients were treated for 16 weeks with this product. And then they had the options to enter another 1-year study for which the data has not yet been fully analyzed and released. So simple, typical phase 2b study, primary endpoint, PASI 75 at week 16, various doses versus placebo. So one of the main secondary endpoint, which was PASI 100. So PASI 100 is a highly clinically relevant endpoint, in my opinion, in patients with psoriasis for various reasons. So in my experience as a clinician, patients with psoriasis are mainly concerned about lesions on their skin. These are people who were born without psoriasis, and then one day, usually in adulthood, sometimes in adolescence, they have skin lesions appearing on their skin. So what they're looking for is not a 50% improvement. They're looking for clear or almost clear skin, and ideally clear skin, nothing goes back to normal. So from a clinical perspective, it's a highly desirable endpoint. Now, this being said, it's always important when you look at clinical data to be realistic in terms of what the current therapeutic armamentarium can bring to patients. So PASI 100, 20-something years ago, when I started to work with biologics and clinical research, was something that you would see only every once in a while. That was not the goal. The drugs were not able, the biologics were not able to bring the patients to that level. Nowadays, it is feasible. So biologics, injectable drugs, have the capacity to bring patients to PASI 100. The level of efficacy that we've seen in terms of PASI 100 is in the order of magnitude of what you can see with some of the most efficacious injectable biologics right now. As I said, because there's no comparative trial, and this is a phase 2b study, one cannot say that it is better or it's a little bit lower, a little bit higher, but it's in the same order of magnitude. And this is an order of magnitude that we have not seen with systemic drugs with oral drugs for psoriasis, apart from maybe cyclosporin that we rarely use nowadays unless we're forced to use it to get access to biologics, which has high efficacy, but as an oral compound, has a safety profile that is problematic and a limit in terms of the time you can prescribe the medication. Yes, so I'll make the difference between what's unique and very interesting about the study, and possibly one of the reasons why it was published in the New England Journal of Medicine, and then what is unique and what it brings to psoriasis in terms of psoriatic patients and in terms of physicians treating for patients with psoriasis. So in terms of what's unique about this study is that for the first time, we were able to show that using or administering a small peptide orally that was selective for one cytokine receptor, we could improve in immune-mediated disease, immune-mediated skin disease, but the same concept could be envisioned for other immune-mediated inflammatory diseases. So I think this opens the door to the development of treatments not only for psoriasis, but for other immune-mediated diseases. And we have a ton of those, and for many of those, unfortunately, the treatments that we have cannot achieve the equivalent of PASI 100 in the skin, cannot control completely the disease in most patients. But now that's like from a general perspective, I think this is what the study brought to quote-unquote medicine. In terms of psoriasis, as I mentioned, this is the first oral agent that was developed over the past 20 or 20 plus years that was well tolerated. However, one has to be careful about the phase 2b study conducted in 255 patients. So we can say from a safety perspective that there are no major safety concerns that are very frequent in patients when given short term, but we can't see anything about beyond 16 weeks, and we can't see anything about rare adverse events. But what's really interesting is that it was well tolerated and the efficacy was very high, biologic-like efficacy with an oral drug, which could, for patients and physicians, give an additional option. So some of my patients, they have no problem with an injectable drug. They're happy, they're fine, and they never ask to be changed to something else. Some of my patients, even after many, many years, they have issues with the injections. They cannot inject themselves. They have to go see a nurse, injection center. Some of my patients will refuse a biologic because of fear of injections or because of the stress that is induced by injections. In addition, my experience has been as a physician, the older the patient is, the easier it is for them to accept injections because they take many medications, they've been admitted, they've had surgery. But when you go down to patients in their 20s, adolescents, and even children, then it's more problematic, and an oral drug is something that is usually favored by much younger patients.